All right, good morning, everyone. Welcome back to TNP's webinars with Anne Laguzza of the Works Consulting. Thank you so much for joining us for this latest update on HR matters as we adjust to COVID-19 pandemic. And I want to say thank you to Anne Laguzza for repeatedly joining us and continuing to be a font of information and just being so wonderful to work with us. Also, thank you to the Josephine S. Gumbiner Foundation for making these webinars available to the public for free. We really appreciate their support going forward. And TNP, the nonprofit partnership, remains committed to supporting you throughout this process and working towards building up your capacity needs so that you can fulfill your missions. My name is Christina Krischbaum, and I'm the program manager for TNP. If you ever have any questions or any needs from us, please feel free and email us at info@tnpsocal.org. And without further ado, I'd like to toss it over to Anne Laguzza.
Thank you. I'm so excited to be back again. This is all really good for me, guys, because it makes me make sure that I know what I'm talking about, truthfully. I'm getting lots and lots of questions every day, but it's really good. And it was kind of nice, actually, to have some quiet time in the last couple of days to review these laws and really make sure that I'm current on them as well and understanding everything. So I've titled I'm just going to do a little bit in the beginning. Maybe it might be 20, 30 minutes, and then we'll open it up for questions. And as we mentioned in the beginning, but if you weren't here yet, is that these are not repeats. Every time we do these, they will be new. We haven't talked about next week yet. I don't know what will be happening next week, but we may open it for a little shorter time and just see if anybody has any general Q&As, but they'll be different every time. I titled this specifically the Families First Coronavirus Response Act as of April 3rd, 2020, almost as a joke, but also truthful, because we had the law was in effect April 1st, and within 12 hours, they had already translated some information to us a little differently than how it was first brought out. So we are learning regularly. I do think things are quieting down. The frequently asked questions on the Department of Labor website have gone from 4, I think in the beginning, to almost 60. I think we're at 59. So I think they've probably addressed a lot of the issues that are coming up, but you know, there may be more. So this is just as of today. For those of you who've been to my webinars before, and if you haven't, I have all kinds of social, and so does the nonprofit partnership. I know they have a Facebook page and they have an Instagram page, and it would be great if you would follow me and follow them, and all of my information's there, because I give out information on pretty much on a daily basis, whether it be specifically law related, or it's to managing your remote teams, or it's just to, hey, I just got off a call. Here is something interesting I want to share with you. So I highly recommend you do follow me if you're not already following me. And I keep that information current and try to keep you up to date. And also, obviously, anything else that I might be doing, other webinars and things that you might also want to take advantage of. So we've got the whole deal about the Q&A box. You guys understand. I'm going to save the question and answers to the end. Maybe I will address your topic while we're going. And even if I don't, that's fine. Just go ahead and ask what comes up, and either way, and we'll just go through those at the end. And so I'll read your questions and then we'll answer them. So as kind of a reminder, this is new territory for all of us. And I just keep reminding people, you know, I have been in human resources and leadership development for 29 years. I've owned my own business for 19 years. I have never led through a pandemic before, ever. The closest thing I have to this is crisis management, you know, with an emergency type situation, but I've never, ever been through something like this that has impacted so many people. I'll just say everyone, both personally and professionally. So be patient with yourself. Understand you're going to say things that you may have to change. Like I said, April 1st, we literally had 12 hours before they translated the law differently. So you may say something to an employee that you may have to change. And that's just how it is. And you're going to have to ask for forgiveness in these times, because these are the times we're in. Also, I think it's really important that you obtain knowledge using trusted resources. It's very important. There are so many webinars going on right now that you almost can overload on information. And of course, I say that as I'm leading a webinar, but I think because we've really based these around Q&A, it's very beneficial for you. So, I know that besides the nonprofit partnership, Fisher Phillips is an excellent law firm, and they are friends of the partnership. If not still on, one of the partners is still on the board of the partnership, Usama Kaf, who a lot of you already may know. They are really on top of this information. They are putting out incredible updates, not overwhelming and easy to read. And you should be on their list, quite honestly, to get their information. They're also doing a webinar next, I think that's April 7th, which I would recommend attending. I'm going to attend. I'm having my whole team attend. I'm pretty much done with webinars in terms of learning because it's just getting overwhelming, but that firm, absolutely, I will do. The other thing is you should have that Department of Labor frequently asked question link saved on your bookmark. You should update it daily, go through, refresh it, and make sure to see if we've gone past number 59. And those are really my main trusted resources right now. And I'm finding I have enough information there. You are not expected to know everything, right? This is all new. Just keep that in mind. And it's absolutely okay to say that I will find out more information and get back to you. One of the things that started to happen since this law passed is that employees may now be asking for the time, right? So I just had a client the other day, an employee sent an email and said, hey, I'm entitled to emergency sick leave. And they went, wait, what, you are? And so if you don't know if they're qualified or how they're qualified, you just say, you know what? If you need the day off today, you can take the day off today unpaid, or you can use other accrued time if it's available. I'm going to find out what you're eligible for, what documentation we need, and I'm going to get back to you. We're talking about a matter of hours. You'll have that information in a few hours. It's not going to be 2 or 3 days, but don't feel pressure when someone calls you on the spot that you have to know right then and there what they qualify for and how they qualify. I think it's more important that you take the time to do it right. Okay, so we're going to start with, there's 2 aspects of this law, the Families First Coronavirus Response Act. And the first one is the emergency paid sick leave. So I'm going to go through this, and I know some of you know these components, but we're going to talk about it, and then we're going to go through the second half. So April 1st, 2020 is when this law came into effect, and it's through December 31st, 2020 as of right now, because they anticipate that many of us will get sick at some point during that time, or a loved one will get sick that we need to care for. Or we're going to have children staying at home, which will be another reason I'll talk about. It is not retroactive. So some nonprofits I know were very generous when this started, and they offered extra sick leave. I helped write a policy for one. They offered 5 extra days of sick leave. So now they're saying, oh, so now that I offered 5 extra days, do I still have to offer this 80 hours? You do. Because unfortunately, whatever you did before April 1st doesn't count in terms of the way this law looks at it. So it's just April 1st and going forward. It is paid for by the employer. So it comes out of payroll. You will pay the employee, and then you are supposed to be eligible for tax credits at the end of the year when you file your taxes. I'm not a tax advisor, so I highly recommend that you talk to your tax advisor about how that will work. I can tell you that they probably don't have a lot of information right now, but they will get it, and you might, at least start, talking to them now about that. Emergency paid sick leave, or ESL as it's called, is up to 80 hours maximum of paid sick leave for specific reasons. But it's an 80-hour maximum, so it's all employees. So if your employee is not full-time and doesn't work 40 hours per week, they're eligible for less. I'll give you an example. So I had a client, the same client yesterday. The employee is eligible for emergency sick leave, so we're going to give it to him. But he only works 32 hours each week. So his maximum ESL available is 64 hours, because that's 2 weeks of his pay. Okay, so it's 80 hours maximum, but it's based on your regularly scheduled hours. If there's no work available, the employee does not get emergency sick leave. So if you already have employees furloughed, if you already have employees laid off, or you lay them off. By the way, if you do this after April 1st, they're no longer eligible. They're eligible up until one of these events happens. Closed, for some reason your door is just, maybe you closed today, maybe you said, you know, we don't quite have enough work for every day. And I say close your doors because I know a lot of you are working remotely, but I mean, there's no work. So we don't quite have 40 hours of work available right now, but we have 32 hours of work, or a reduction in hours, and they're not eligible for emergency sick leave. This is when they are eligible. And somebody was asking this question, I think, but you're open, right? And they don't want to come to work because they're going to be, and I'll talk about this in the next slide, but they're going to be following the isolation order. And I'm going to talk, I'll pause on that for just a minute because I don't want to get too far ahead of myself. But this is when, these are the times they're not eligible. So if you already have employees furloughed, they're not eligible. If you reduce their hours, they're not eligible. Documentation is required. Now, I didn't go into detail in documentation in this presentation because it's very convoluted and it was so hard to explain. It was just so many words and so much, but I can, again, you guys reach out to me, reach out to Christina. I can give you this really simple guideline that I got how to determine what the documentation is. It's pretty easy. And then if you're under 50 employees, you may have a possible exemption for one qualifying reason, but you're not exempt from all emergency sick leave, which was also bad information that got out there at the beginning of this law being enacted. And there is no waiting period, so your employees are eligible. So employees, anybody on your payroll now is an employee, okay? We're not talking about contractors, we're not talking about interns that are unpaid or paid a stipend or something connected to like a school contract. But if they're employees, they're paid through payroll, they're your employees. So here's the qualifying reasons you can take emergency sick leave. And I know there's a lot here. And this is, I actually have my poster right here. You should have a poster up in your workplace, which a lot of people ask me about that, by the way. They said, there's no one at my workplace. So then make sure to email it out or put it on your intranet or put it on your website, somewhere where your employees can access it, because they do need to have this poster. And it has all these reasons right on there. So the very first reason is if the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. So this was one of our first questions we got in our Q&A when we were opening up. So safer at home is a local isolation, or sorry, it's a state isolation order, but this is how it works. You're open for business right now. I work in your office and I say, you know what, I'm not feeling comfortable coming to the office because we're under this isolation order, safer at home, and I want to stay home. So if you say, you know what, Anne, okay, that's fine. We'll let you work remotely. I'm not eligible for emergency sick leave then. Okay. If you say to me though, no, you know what, we don't have remote work for you and you've got to either come to the office or there's no work, then I go, okay, well then I'm going to take some of my emergency sick leave and then I'm eligible because I'm under the safer at home isolation order. That's a really important distinction because a lot of you have people working remotely already or are not having them work at all. And they're not eligible if they're not working, because the reason it's set up this way is the employee is staying home to stay under this order, right? And there's no work available for them. If there's no work already anyway, they're not eligible. If the hours have already been reduced or they are reduced sometime in the future, they're not eligible to supplement their income with reduced hours because there aren't 40 hours available. There are only, let's say if you reduce my hours to 20 per week, there are only 20 hours a week available. So, and I'm already working remotely. So there's no sick leave to ask for. Okay, so that was a huge clarification and I'm so glad that they actually did it. Have they been advised by a healthcare provider to self-quarantine related to COVID-19? They would be eligible for their sick leave, emergency sick leave. Is experiencing COVID-19 symptoms and is seeking a medical diagnosis. So this is, hey, you know what? I woke up today, I've maybe got a little shortness of breath, I've got a fever, I got to get to a doctor. Okay, great. They can request, and they request this, by the way. You guys are not just dumping this into their paycheck. They request it. That they have to obviously know their rights. And they would take some of their emergency sick leave to go see a doctor. That might be a day, that might be a day and a half, something like that. Is caring for an individual subject to an order described in 1 or self-quarantine is described in 2. Okay, so caring for somebody who's either respecting the safer at home isolation or I should say respecting it, but I don't even want to say complying with it, but, you know, following it, I guess, or, you know, not feeling like they can go into work and they don't have remote work available, or doing a self-quarantine as described in 2. And 5 is caring for their child whose school or place of care is closed or child care provider is unavailable. And this includes a private child care professional, if you have someone who just comes into your home, due to COVID-19 related reasons. Okay, and we're going to talk a little bit more about that as well. And then number 6, quite honestly, the attorneys I'm working with are saying, we don't really even know what this one means. It's like, is this a catch-all for maybe something else that might come up? Maybe they're thinking there may be something else. I don't know. So right now 6 is out there as in terms of other substantially similar condition, but it will be specified by the U.S. Department of Health and Human Services. So for right now, your employees are mainly going to be focusing on 1 through 5. So how does compensation work? Now, I didn't get into all of the limits. There are limits. I do have the poster here, and I do know, you already know some of you asked questions, and I will get back to that. So I will follow that. I have my whole like COVID-19, all my trusted resources. I printed just the ones that I trust and that have helped me the most, and I keep them with me at all times. Okay, so there are limits to the compensation, and they're defined by day and by week. If your employees are out of work for reasons 1, 2, and 3, so that's that they're doing safer at home and you don't have remote work for them, so they're not able to work because you want them to come into the office. They've either been advised by a healthcare professional to self-quarantine, or they're experiencing symptoms and seeking medical treatment. They get 100% of their wages up to the daily and weekly limits. So your higher income people may max out and they might not get what they normally would get paid because there's a maximum on the wages, and your lower income earners will probably be fine. They probably won't even reach the maximum. Then reasons 4 and 6, which have to do with caring for someone, an individual, or caring for your child because they're out of school and there's no COVID-19 illness, thank goodness, it's just that they're out of school, is paid at 2/3 of the employee's regular rate up to the daily and weekly limits, which are much lower. Okay, and this does apply to all employees. So that is really the Sick Leave Act, the Emergency Sick Leave Act. Okay, so let's talk about the other part of this Families First Act and talk about Expanded Medical Leave Act. So EFMLA. So EFMLA is really interesting because it's really only to care for a child whose school or place of care is closed due to COVID-19 related reasons. It's an additional 10 weeks. And the reason it says only 10, because you may be familiar with FEMLA, CIFRA, which is normally 12 weeks. So the reason it's only 10 weeks is because they've already got 2 weeks paid under ESL. So they've got 2 weeks paid at 2/3 of their regular rate under ESL for this reason. And then they have 10 weeks under EFMLA paid at 2/3 of their regular rate up to the same limits. And the employees have to be employed with you at least 30 days prior to making this request. Okay, so that's all that EFMLA is for. You have to keep their job. I mean, in both these cases you do. You have to keep their benefits going for these additional 10 weeks. They still pay their portion if you have them contribute. And that's how it works. It's just pretty, it's actually pretty straightforward, believe it or not. So let's talk about exemptions for a moment, because some of you on this call may be eligible. So when this law came out, one of the things that was said is, oh, everyone's exempt that's under 50 employees. Well, that's not true at all. There is one possible exemption for you. So first, you have to be under 50 employees to even consider being exempt. And you may be exempt from providing emergency sick leave only due to the school or daycare closure due to the COVID-related reasons. So, or place of care closures. Yeah, okay. So that's the only reason for ESL. So you still have to pay ESL for all the other reasons. And then number 3 is you may be exempt from providing the EFMLA completely when it would jeopardize the viability of the small business as a going concern. Now, again, there are reasons for exemptions. They're outlined by the Department of Labor. what you would do is you'd read through those potential exemptions, identify what you fall under, and you're going to write a document that sort of you're going to retain for your records that says, this is why we are exempt. And you're going to go by those orders. Then you're going to also prepare a document for your employees to tell them when you're exempt. Now, there is another exemption I didn't discuss here, which is about healthcare providers. So if anyone's a healthcare provider, we can talk about that, but that's a total exemption from the entire Families First Act. You get an entire exemption from this because you're open right now, you're essential, you're an essential business. I love, by the way, that, some of us now are walking around going, we're non-essential. We're all essential, but some are more important right now than others. So you're going to document this. You're going to notify your employees why you're exempt or that you are exempt, and so that they're aware, so they know not to ask for either one of these benefits for that reason only. Okay. And then you're going to keep your documentation because today nobody wants to see it. The Department of Labor doesn't want you to mail it to them, but I imagine soon they will, or they may ask at some point. So here's just some general tips that I want to go over. Have a separate line item on your wage statement for ESL and EFMLA if you're offering EFMLA and you're not exempt, obviously. So this means contact your payroll provider, or you go in and you create an extra line in your wage statement. One should say ESL, one should say EFMLA. We want easy documentation to prove that you paid out whatever the employee requested up to the maximum that you had to provide. You do not put 80 hours of sick leave into a bank that shows up on their wage statement. You are just going to, it's just sort of runs in the background, if you will, and they pull from it if they need it, and then it gets tracked on their wage statement what they've used. Okay, so we're not putting 80 hours in there for them to use whenever they need to. That has not been a requirement today, and I don't want you to do that because I don't want employees to get confused. Go slow. Okay, take the reasonable time you need to review the information before promising ESL and EFMLA. And I addressed this already a little bit at the beginning. This is new for us and we don't always know. Yesterday when I got this request, so what the request was, the employee's 66 years old and he has some underlying medical conditions and he would like to I couldn't remember the word, but he wants to basically fall under category 1 that he wants to follow safer at home. Okay, so that's what he wants to do. And so they said, gosh, we don't know if he's eligible or not. So we worked through it yesterday and he is eligible. We figured out the documentation we need him to fill out and we sent him that information. I created a form for them and we sent it to him to fill out. And it's okay. I mean, really what they told him is, you know what, that's fine. Stay home. No penalty right now. You're just unpaid or you could use accrued time. As soon as we figure this out, if you're owed emergency sick leave, we're going to go ahead and give it to you. So that's what we did, and it worked out. Your regular policies apply for sick leave, vacation leave, holidays, etc. Don't forget, you guys have policies right now for all kinds of things. So if I wake up today and I have a cold, that's just regular sick leave. If I wake up today and I tell you, oh gosh, my arm's hurting or my back's hurting a little bit, I think I'm just going to take it easy. Whatever your regular policies are, don't use the emergency sick leave. It's just for very specific reasons. And I am hopeful that none of you get a full workforce needing them, because then to me, they will be really sick. Because I know a lot of people have been able to go remote, or many of you have furloughed or laid off employees potentially. I know a lot of my clients have. Maintain detailed documentation on everything you do related to ESL and EFMLA. So if you have an exemption, write that, make sure you keep that documentation. I already talked to you about the separate line item on the wage statement. You may want to put together a temporary policy. That's up to you. I feel like this poster is sufficient and go from there. There's a lot of ins and outs that I feel like a policy, it'll just become probably cumbersome. And I don't want you to misquote it. I almost would, your responsibility is to follow the law. And because the law continues to move, I kind of want you to just sort of hang tight and use what they have right now. And then maybe, I don't know, maybe as this proceeds in the next few weeks, you'll hear me talk about creating a policy. We may do that. I'm going to talk to some of my legal team about that and see what their thoughts are. And then of course, make sure, any employee requests this type of leave and the appropriate documentation that they need to submit to you, you want to keep that in their medical file. So you have a good tracking system for all of this. The issue, of course, is there's a couple things. I mean, legally, a lot of attorneys are stating that we will see lawsuits come out of this in the end for a variety of reasons. So we want to be prepared for that, and not just related to this. Unfortunately, there's going to be other things, but also you have the potential for the tax credits on the other side, and you want to make sure you're keeping documentation for what they're going to need as well. Which actually leads me to my next bullet point, which is that the IRS will have guidelines for appropriate documentation. However, what's funny is they have a link, but as of yesterday anyway, I checked it and it wasn't working still. So I can make sure Christina gets that link and you guys can check it. Again, I'm not a tax professional, so work with your tax professionals on that. There will probably be more guidance on what they need in terms of how you get a credit. But I think if you're doing the things that have been given to you so far, you're doing what's reasonable and what we've been asked to do up to this point. So that's really the best way to work through this. Okay, so with that, I am going to move over to question and answer. I feel like there was one thing I forgot to tell you guys, but I know you're going to ask me some great questions. So what I'm going to do is I'm going to start jumping through question and answer. I will just go, as you guys, if you've been on this before, and if you haven't, I will run through this question by question for as long as we have questions, and we have until 12:30, I think. And if we're done sooner, we're done sooner. And I'll do my best to answer those questions for you, and then we'll go from there. Okay, so let's see. So I think we have anonymous attendee asked about the lingo regarding the safer at home order. And that does, so we are currently under an isolation order by the state. But if you offer remote work, your employees actually are not eligible for emergency sick leave. By the way, unless they're at home right now and they can't work, right? So if I have symptoms or if I've been diagnosed with COVID-19, I may not be able to work remotely. I mean, I think it's all varying degrees. Some people are very sick. Some people are not as sick. They're not exhibiting the same kind of symptoms. So I think that's a conversation you want to have with the employee. If they want to continue working, great. If they need to take 1 or 2 days, they can use their emergency sick leave for that. But if you're closed or furloughed, or if you close or furlough down the road or reduce hours down the road, they're not eligible. Okay, so let's see. Hi, Anne. If you take the 80-hour sick leave or expanded medical leave, can you also apply for unemployment insurance for the state of California? Not that I'm aware of, because it is paying you equivalent. Emergency sick leave is paying you, for many of the reasons, equivalent to what you were making, and they're paying 2/3 for the other reasons. And my understanding is those reasons are not unemployment eligible. I believe they were trying to offer some unemployment for a little bit. I heard a rumor, I don't know if anybody ever got it, for having to stay at home with your children, but that I'm imagining has gone away at this point, because and potentially if you're exempt, they might be able to get it, but I wouldn't think so. But here's my rule on unemployment, is that you can certainly notify your employees about it, but don't worry about it if they get it or not. Because I want to make sure you guys don't get too far into something that the state is administering and that you have no control over. And I wouldn't want you to promise an employee they're going to get something that they don't get. So I just, if an employee asks me, would I be eligible for unemployment? I'm like, you know what? You could go ahead and apply. I don't know. Let's see what happens. I mean, we're in unusual times right now. Let's see what happens. Please clarify paid family leave for childcare due to school closure. Employer must pay. So I think I did clarify that. And that would be called, make sure you guys use the right terms for these, because it's added to our complicated or convoluted leave process already. It's expanded FMLA, or expanded Family Medical Leave Act, whatever you want to call it, either one. That's what it's called. And it's for childcare due to school closure. And there are limits, that is correct. And it's for additional 10 weeks, because they'll take the first first 2 weeks will be under emergency sick leave, which is ESL. Under unemployment insurance, the federal government will be providing an additional $600 or up to $600. I do not know. Again, I really rely on the unemployment department to take care of their regulations. I have been very impressed with their website though, so I don't know if you've gone there lately. They are the one sort of government agency that's really been impressive with how they've been keeping up. So I would definitely go there and check that out. But again, if it's I don't know if it's for yourself or to talk to an employee, but I sort of let employees handle that, just because, again, I don't want to get too far into what they're qualified for, and then have them not be qualified for it. Like, let's say you were trying to reduce their hours, but hope that unemployment would make it up, and then you base what you reduce their hours on based on what you think unemployment's going to make, and then they don't, or pay them, and then they don't get that. I kind of steer clear of that. I just give them the information, tell them to utilize those resources. I've heard from several sources that unemployment, although they have reduced their hours, has been really helpful. So that's, again, it's kind of a first for them. I'm pretty excited about how they've handled this. What good is a tax credit for a nonprofit that is paying for the ESL? We don't pay any taxes and don't have any withheld. I don't know what to tell you about that. I feel like that is an issue that is what it is. I would talk to your tax professional and see if there will be any benefits for you. But as of right now, nonprofits have not been excluded for this. You will have to still pay it. Can you share the poster with us? Yes, I'll make sure Christina has a link to the poster, but you guys really make sure you have a resource that's getting you that information, and don't buy any posters right now. That's my tip. If anybody's trying to sell you any posters, don't buy them. They're all free. And I just saw something go out the other day. It's like new posters and they want you to buy a whole new poster. You do not need to buy these. They're always free. All posters are free, just so you know. It's just there's so many of them. It's nice to have them all in one laminated version when we're talking about all the other ones. Okay, let's see. Under the emergency paid sick leave, if an employee is an essential worker and chooses to stay home due to the stay-at-home safety order, and there is not remote work, then can they use the emergency paid sick leave? Yes, can. So that's an exact example. So I mentioned, I think before, I work with a homeless they work with homeless, in the homelessness population. They are currently open. They have decided that they are essential to help maintain some, cleanliness and food and everything for the homeless population. And those employees, if they could not come into work, or they want to stay at home because the safer at home, they could definitely exercise their rights under ESL and request some time off. And that would be fine. The one thing I will say that, you can't tell employees what to do, but my friends I'm sharing with is like, I would wait if you can wait. If you really don't feel safe at work, that's one thing, but if your work is trying to practice safe, trying to put safe practices in place, I would try to save this emergency sick leave, because I have a feeling that people are going to need it. And I don't think it's going to be more available. So that's a tough situation. Okay, we closed our orthodontic center prior to April 1st for general visits, but remained open for emergency cases. The California Dental Association is saying being open for emergency cases is not considered being open, and our staff is not eligible for the 80-hour sick leave and medical leave, and suggested being covered by the payroll protection program. I have not followed anything on what the California Dental Association is saying about I don't know if the California Dental Association gets to overrule employment laws. I'm not familiar with that, but my feeling is if you're having someone come to work, they're coming to work, and then they potentially could be eligible, but they wouldn't be eligible for more than what you're scheduling them. So if it's a limited schedule, I mean, if it's only for emergency cases, I'm assuming you don't have a lot of people working or for a lot of hours. So it wouldn't even be 80 hours that they'd be eligible for. They'd only be eligible to replace whatever it is you currently have them working. So if that's like 4 hours a day or 2 hours a day, or maybe 6 hours a week, 2 hours each day per the week, that's all they would be able to replace if they did use that. But again, do not, and I don't know the payroll protection program. I'm not a banker. I've talked to 3 bankers already this morning, starting at 6 a.m. and that's been hilarious. I feel so badly for them. I feel like that's where I was in HR just last week. But Yeah, I don't know if the payroll protection program is going to cover anything about the sick leave. They very well may. I just don't know that. When can we get the poster that we need to send to employee? Oh, where? You know, it came out through the Department of Labor, but I'll make sure Christina gets it. The Department of Labor is your best friend right now. I'm telling you. I wouldn't probably say that very many times, but they really are. But I'll make sure Christina gets the link. We're paying all of our employees, even if they're not working. If they are not working, do they accrue PTO? So, oh, good. One of the things I like about this question is, by the way, I forgot to address that category. Perhaps you're paying employees even though they're not working, because I do know people are doing that. And they're also not eligible for emergency sick leave because they're not even coming into the office, right? And you're paying them anyway. So they actually are able to do whatever they need to do. I don't know why they'd want to take the emergency sick leave. And then if they are not working, do they accrue PTO? I think that would be back to your policies. And if your policies are obviously not clear for something like a pandemic, you may want to rework that policy. I kind of feel like, I don't know how many employees you have or what your accrual is, but if it's pretty minimal, I may still allow them to accrue, but you may not. You may want to put together a policy that's specific for the situation you're in right now, which is employees are basically being paid not to work, and they won't be paid holidays. They won't accrue vacation or PTO if you have that, or vacation. So you may want to do that. By the way, be prepared for this to go on longer. So maybe start thinking about some of those things. Like if you do have employees you're paying and they're at home, well, I guess you'd pay them anyway, even if there was a holiday, but just think about those things. You can see I'm processing this as we go. Can you please tell me where I can get, okay, yep, poster link is coming. Okay. So this question says, my question is related to dealing with personnel issues in the time of COVID-19 while work is all remote and we are operating on Zoom. Any tips? Oh, I need more information. I don't know what you mean by that. So that I don't know. I mean, if I'll tell you a little bit about what I've been talking to other people about is you 100% keep managing your people and you treat Zoom like an in-person meeting. So you hold them to their expectations, you hold them accountable, you continue to have your meetings. And if they're not meeting your expectations, you make a meeting time with them, you do face-to-face, and you say, hey, I want to go over a few things that I have concerns about. You said issues, so I'm assuming this is concerns. And I wanted to go over the issues that I have with you. And it's a new world right now, but please don't stop managing your teams, because if you are following me on Instagram already, you will see a story today, and you might have already seen it, where I'm telling you, this is your moment for your low performers, man. They love nothing else than being undermanaged. So you've really got to jump on that right now. And Elizabeth, if you want to give me more information, I'm happy. I'll get down to it later. It doesn't look like we have too many more questions. Are we having access to the recorded version of the webinar? Yes, I believe Christina always posts it. I also post it. If we reduce people's hours, do they receive unemployment? They absolutely are eligible to apply. So if you reduce their hours, they're absolutely eligible to apply, and you should tell them that they are eligible to apply. And again, it's up to unemployment. My understanding is they're being pretty generous with most of those requests, but I don't want to guarantee it because I don't know how much they earn. And then they have to be honest about reporting, of course, as well, to make sure that they're not getting more than they would have normally gotten. And it's not 100% replacement unless they've changed that. And from what I know, they haven't. It's not like I was making $100 a day. You're only giving me hours that equal $50 a day. So unemployment's going to give me another 50. Now I keep hearing they're changing that, right? So people aren't going to be suffering during unemployment time. So that may alter a little bit, but again, I would leave that to unemployment. I would tell the employee, I'm not sure how unemployment will compensate them, but they definitely are eligible to apply. I don't know anything about tax credits. I'm very sorry about that. I'm not a tax professional, so I'm very hesitant to give tax advice. I don't know. Yeah, I'm not sure. I've heard a couple of different things and I don't really know what the truth is right now. How does unemployment work for seasonal employees? If they were employees, they can still apply. The unemployment, the period that unemployment will base their wages on, or their eligibility for wages may be different. It may include your employment as well as other employment, but they will still be eligible to apply if they were employees. If an employee is already remote, then they aren't eligible for ESL. So that is correct. Assuming, again, like if they are too sick to work, just like you would do in any sick policy, right? If I'm too sick to work today and I'm like, whew, I can't even give the attention to emails or whatever I need to do, I really just need to lay down and get no phone calls, then I would ask for a regular sick day. If it's related to one of those reasons for COVID-19, then I would put it under ESL. They're not eligible for number 1 when they're working from home, because that's abiding by the safer at home order, which they're already home. So there's no pressure for them to leave the workplace. I mean, to leave their home to go to the workplace. How long is emergency paid sick leave for? Is it like disability leave in 50 to 60% of pay? Emergency sick leave is up to 80 hours. It's based on the regular hours that the employee works, and there's all kinds of calculations that the Department of Labor has given for those of you of people who work under 40 hours a week, and it's a total of 80 hours. That's it. So for right now, it's from April 1st to December 30th. They have a chance to use 80 hours, and they can use it in, you know, increments of hours. Like I said, if I feel like I'm experiencing some symptoms, I'm going to go seek a diagnosis. Maybe I'm just going to make a phone call to talk to my provider, whatever it might be. And so I just might need a few hours. Okay, we have a non-exempt staff member working in a retail setting and the store is closed, and we have work available for him. He doesn't want to work and would rather take the 80 hours of sick leave or unemployment. So I'm not going to say who that is, because I'm going to say a couple of things. I mean, my first question is, of course, is this your very, very best employee? And I'm guessing it's probably not, because I'm finding your very best employees are really being as you know, they're fearful also, but they're trying to be as reasonable as they can working with you, understanding that you're trying to do what you need to do. So technically, if he is coming in to the retail setting, even though the store is closed and he doesn't want to work, and but why doesn't he want to work? So he needs to tell you the reason. So if he says, I would say, why is it that you don't want to work? Is it, you know, he needs to tell you it's because the safer at home. He feels safer at home, and then he could apply for, I mean, he could ask you for the emergency sick leave. He could do that. And then after that goes, what I'm telling employees is if we have work available and you're out of your emergency sick leave and you have no other accrued time off available, the flexibility I'm giving is I'm suggesting to my clients that you let them stay off unpaid. I do not call it a leave. I do tell the employee that there's no guarantee of employment though at following the end of this, because I don't know what's going to happen, and I don't know what decisions you're going to need to make. And if somebody's just at home, you might decide that might be the person you decide that you don't want to return, because if you have a reduction in operations. And I don't know that they'd be eligible for unemployment, because my communication to unemployment would be, we have work available. And the way unemployment works is you have to be available to work. You have to be available and willing to work. So if you report to unemployment that you have work available, he's voluntarily choosing not to come in and already exhausted his emergency sick leave. I don't know. I don't know if they're going to give them that, but I would be very honest with the employee about that too, so they're very clear. I always think that's important. If a staff member uses up all of their 80 hours of sick leave and their family leave now, and later they get COVID-19 or some other ailment, are they still eligible for personal medical leave in the same year? So again, if it's, I don't know what personal medical leave is. If you're 50 or more employees, there are some things about they won't be eligible for regular family medical leave again in the same year. So it wouldn't be the case. I don't know what your policy is. If you have a policy on a personal medical leave, you may need to follow that. Probably what's going to happen in California, and we haven't been down this road yet, is you're going to accommodate their time off under Americans with Disabilities Act, because they're going to have medical documentation that says they cannot come to work. That's my guess. And we haven't been there yet, but that's why I'm kind of encouraging employees. Like, I know that I've actually heard some people say like, oh man, I wish I could be at home. You know, like people are just hanging out at home, not working. And some people might be, but I know a lot of people are working really hard. And I'm really encouraging people that I know to save their sick leave, because I'm like, you may really need this. Like, this could be a situation that you may wish that you had it and you weren't just taking it as like, I need a break. If you need a break, ask for some vacation time, you know? So we will be playing that one out for sure. Okay, hi Anne. If our business is physically closed due to safer at home and one of our remote workers somehow gets COVID while working at home, are they still eligible? So yes, they would still be eligible as if they feel like they can't work. Again, I would have these open dialogue discussions, because I know people who have had it and still been able to work. I know other people who've been very, very sick and did not feel well at all, or didn't feel well for 3 or 4 days and then were able to work. So I would just have a conversation with them about how much time off they feel like they need, if they need time off. But yes, they would be eligible if they actually get sick, because it provides them some compensation under ESL, and then it provides them the job protection. Oh, well, no, I'm sorry. Yeah, it would be under ESL, not EFMLA, but under ESL, it provides them with financial support. Okay. Hi, Anne. Our agency provides essential services because we operate shelters. What are your feelings about asking all employees who show up to work to take their temperature before they start their shift? Oh my gosh, this is a great question. You know what? This is one thing I have not done a lot of research on. I have one client and they're in Nashville, and they're started the temperature testing, but they're doing it voluntary. So they came out, I know they're doing voluntary. I would have to get more information on that. And if you remember, if you will email Christina after the webinar, and I will try to find out about that. I mean, I know everyone's trying to be as cautious as they can. I'm pretty sure you can make it voluntary. I wonder if we can make it mandatory and what that involves. And then what kind of thermometers we have to use, and you know, obviously all of that. So all the precautions we need to take. When you say reduce their hours, is this a furlough? No, not necessarily. So a furlough is usually when they're not working at all, but you're still keeping them as employees. Some of my clients are maintaining their health benefits during furloughs, others are not. And it just says, we're not terminating your employment because we anticipate this is going to be a short period of time, and we're anticipating you'll be able to come back. Reduce their hours is where literally, so this just happened, one of my clients, they said, you know, we don't have 40 hours of work right now because we're not even open, right? But we have about 20 hours of work a week. So we're gonna reduce your hours to 20 hours a week. So that person's only working 20 hours a week now remotely, because that's all they have available. So they're not eligible for the emergency sick leave under number 1, again, under the isolation order, because they're already working from home. And there are no extra hours. They can't make up the separate hours. Oh, that was a statement, not a question. Okay, I don't remember what that was, but okay, I'll try to get back to that in a minute. Okay, so you have an employee who has a significant performance concern and was starting the disciplinary process with our HR team when our campus went entirely remote. Just seemed awkward dealing with this over Zoom. Yes, got it. It is awkward. This is awkward times. I mean, it's just awkward. I mean, you know, fortunately, you know, I'm really thankful right now that I'm able to keep my employees working, but you know what, if I'm not able to in the next few weeks, I'm gonna have that awkward discussion over Zoom. Like, that feels terrible. Like, hey, we're gonna reduce your hours. You know, I mean, that just doesn't sound good. So I'm hoping we don't need to go that route, but you know, I'm realizing that we just don't know what's happening at this point, and we've got to be we're gonna have to be flexible if we need to. But yes, definitely just keep going, and you can even say things like, you know, ideally we'd be having this meeting in person, but you know, that's just not a reality for us today. So, and what I would say is, I feel like it's really important, and I owe it to you to continue to help you with your performance, because it's important to us, and we hopefully won't always be working remotely. We will eventually be working together again. And I want to make sure that we're moving in the right direction. I think the first time we're going to have to terminate someone over Zoom, it's not going to be great. But I will tell you, I have a client that terminates a lot of people over the phone because their workforce is not, they're all over California, and they all work very independently, and they don't come into the office. So for them, it's a daily occurrence. It's not even unusual for them to have performance conversations over the phone. They do investigations over the phone. It's fascinating when you're around a business that has to operate that way. It's so normal for them. Okay, if an employee has used a portion of FMLA and needs EFMLA, they would only be entitled to 12 weeks in a year, correct? That's absolutely correct. So the Expanded Family Medical Leave Act is providing some payment, right, for one specific reason. So basically it's adding on an extra reason. They're calling it expanded, and it's also supposed to be temporary. So you're right, they will never get more than 12 weeks in a year for FMLA. I know lots of construction sites are requiring temperature taking. Yep, that is true. That is true. That's exactly, my client is a construction company. To clarify, reduction in hours can then lead to an employee to file for UI to supplement their income, so that can help the employee decide how risky their income is. Yes. I mean, they can still file for unemployment. I think what I'm just encouraging is we maybe don't try to guess what the unemployment is going to cover. And that's all I'm suggesting. We have some employees on our payroll who haven't worked at our organization the last 6 months. We run a theater and have a pool of ushers and tech crew. They have some sick time in their bank. Can we terminate them right now and clean our books, or would it look bad if we do this? I love that question. Okay. I have to be thoughtful about how I answer this here. So, I mean, I don't know that you actually have enough work right now for everybody. So maybe how we need to phrase this is that today or Monday, you're going to be going through your employee list, and you're going to be determining which people you really don't need right now, because operations have slowed down such that there's no work for them. So you're going to furlough them, right? And put them on a temporary layoff, if you will, or you're going to completely lay them off. And you can do that. So that's the way I would phrase that a little differently. I would just look at all positions and determine which positions right now do we not need, and we would like to furlough them. Or you could lay them off if you wanted to, based on the fact that your operations have completely dropped and you don't have any need for them. Okay, those are all our questions. If you guys don't have any others, I think we're done early today. The reason I'm excited about that, I mean, we're not running away, but the reason I'm excited about that is it means you guys are starting to get a handle on this, and some other important things are coming up, which is good. You're hopefully able to start getting back to working a little more normal. We'll say in quotes. I guess I know for sure, I'm sure Christina's going to say this too, but I would love to know from you guys what you would love us to talk about next time. If you want us to talk about something next time, we could always leave time for Q&A, but if there is anything in particular you think that would be helpful to really help support you as much as possible, focusing again I'm obviously on the human resources side and the leadership development side. I'm really trying to identify what we can do to help you during this time. So I'm really happy to do it. I'm fortunate that I have an opportunity to do it. And I really enjoy, like I said, interacting with all of you and giving you the answers to these questions, because it does nothing but help me. So I don't think I saw any others come in. So Christina, I think if you're available, we will just have you pop in.
Yeah, I was just checking in because I saw the Q&A portion started to climb up again once you started to wrap up, and I was like, and I just wanted to make sure if there's any last minute questions that we do have those. But no, I think it's coming in of lots of thank yous, so that's good. I see that. So with that, thank you so much, Anne. Absolutely, if you have questions or if you have ideas for additional webinars or trainings that you're looking for, please email those suggestions over to info@tnpsocal.org. I want to thank you, Anne, and I also want to let everybody know that we did send out an email this morning to all of our followers, and it's also up on TNP's calendar. We do have 2 webinars next week. So on Monday, we have Brian Yacker and Stacy Bergman with YH Advisors. So they are our tax advisors, and they will be covering more information on the federal relief programs for nonprofit organizations. Some of the information that Anne shared today, but also talking about some real world applications in that, and discussing some experiences that you're all having. So they will be there for a full Q&A that will be 2 to 3:30 on Monday, April 6th. And also next week we have Patty Ertl of the Ertl Group, who will be joining us for our Thursday webinar. What is the role of a board of directors during a crisis, and how you can engage them more and make better use of their strengths and resources at that time. So that will be April 9th, Thursday from 2 to 3:30 as well. So we look forward to seeing a lot of you next week online, sometime in the future in real life. We know that we're looking forward to that as well. And we do look to hold these again, maybe next week, maybe in 2 weeks, kind of we're going to take the temperature of everyone and see when we want to schedule these. But I think these Friday sessions are really working out for a lot of people. It's nice to just check in and hear what are the latest updates, because things are moving so quickly. So I think we'll try this again for next week. So hopefully we're looking at next Friday, and we'll coordinate those schedules with Anne, and we'll get that up on the calendar very soon. For those of you also that are looking for any of our past webinars or videos of those, you can find those on TNP's website, so tnpsocal.org, and you go to our resource page, you will see all of the webinars listed up top, but we also have links for additional information on the loans, on tips for working from home, on tips for how to, manage your staff. But I did also hear that question too. So we're also looking at, maybe how to manage that remote staff a little bit more, or how to manage staff that are working on site and that are working remotely, and how to help them connect. So we have a lot of great ideas that are coming down the pike, but we want to hear yours as well. What are your needs, and how we can really be supportive for your organization during this time. So again, thank you everyone. We wish you well. We hope that you're staying safe. We appreciate for everybody for staying at home as much as possible and helping us flatten this curve, and really looking forward to getting back to, as you say, and getting back to normal. This will be our new normal, just for hopefully a short period of time. So from TNP, thank you, and thank you again to our sponsor, the Josephine S. Steiner Foundation, for making these webinars fully available to everybody for free. We truly appreciate their support during this time, and everybody stay well, stay safe, and we'll see you soon. Thank you.
Thank you. Have a great day.